Hey, welcome all. I am Balakumar Kunthu, Managing Delivery Architect working as at Capgemini America, Atlanta. So today I'm going to talk about IoT in healthcare. So you all guys must have aware of what is IoT. Just a brief intro on IoT, what is all about IoTs. So IoT stands for Internet of Things. It refers to a network of physical objects that are connected to the internet and can collect and share and act on the data. These objects contain sensors, software, and connectivity that allow them to communicate with other devices or systems with the human environment. So some of the examples are like smart watches tracking heart rate, home devices like smart lights, thermostat, door locks, and connected medical devices like wristwatches, somebody monitoring the heart rate and other things. How it works basically is like it has a device and sensors, collects the data, internet stands the data to a system or cloud, software analyze it, and then it acts on it. So it has its own intelligence to act on it one. So why IoT is needed for healthcare? So basically, for decades, the way that we manage our health, patients get sick, we visit a hospital, we receive treatment, we return home, and then wait until the next visit happens. Especially the countries like US to get an appointment, and then as well as uh, to more about getting an appointment is very tedious. So, like instead of waiting for an appointment, if it is a real time input, if I get it for a critical illness, that will be really helpful for us. At the same time, we can also avoid a lot of traffic to go around based on the doctor's availability, a lot of time saving to save the life. That's why we want to talk about today what how the IoT in healthcare is going to be helpful actually at all, right? So let's get into the topic. So in the so what is this IoT in healthcare? And then basically we are talking about how it is going to be powered by the combination using a telecom technologies, right? So we have seen like how telecom evolved 1G, 2G, 3G, 4G, 5.5G, and then 5G and then 6G, which is coming in future. So what it does is all about uh, uh, it's all about how we are handling the latency and the bandwidth and how speed the information to be delivered. So till 4 or 4.5, we are all talking about availability of connectivity, but we were not talking about how well connection to be established, how bandwidth will be utilized for more, right? So 5G especially, it's going to helpful and revolutionize medical care. It enables a real-time remote monitoring for a patient's healthcare, and then it's also have a high definition. So it all talks about the bandwidth and the speed of it, right? So when we have a device like at the same time, if the device sends the data to the hospital, and then the hospital system monitoring it, it analyzes and then gives the feedback immediately to your care doctor. Then the care doctor can act on it actually, right? So it has to happen within the few minutes instead of taking hours to go on doctors to come back and do that one. So that is going to go away from the traditional systems into handling a healthcare in a near real time, right? This capability was very impossible using a previous technologies. That's why we are all talking about how we are going to manage this using a remote monitoring facility powered by 5G, right? So coming to that, what are the challenges we are going through in the healthcare is all about. In the legacy world, we have a legacy network causes latency, right? So we are talking about high latency over here. So we need to overcome that. So combining a technology, what we have in the available in the space of a telecom, we can always go and leverage this actually, right? And then we have a restricted telecom telemedicine right now. There are availables, healthcares are available, making sure that you call the doctor, they talk to you, and they just over the telemedicine they take a input, but however they will suggest some medicines and go forward. But it is not the symptoms to be analyzed. It has to be coming from the human to talk about. But we are talking about a device to measure your information and feeding to the doctor without a human intervention, right? And then compromised emergency care, like emergency going to emergency is there are process there. We need to call them, and then we go there, and then based on the illness, they admit whether it's emergency care or not. Then delayed vitals. Vitals are very important when it comes to heart attack or a stroke. If there are delay happens, so then that vital is very crucial. Without delaying, the information should go there. Then, of course, doctors should have a clinical visible impacts where the information should be available over there. That's why how are we going to transform this? The healthcare transformation challenge is very really important actually, right? How are we going to manage this? So what changes with the 5G? So 5G brings high latency with a 7 to 200 milliseconds. More than that, than limited bandwidth capacity, what we are going through right now. So how it is going to be overcome by 5G? We will talk in the next slide, right? This is a game-changing solution where fifth generation network offer transformation capability for healthcare, especially for healthcare. And it brings down the latency to less than 1 millisecond. Earlier, we just saw the 70 was the earlier generation one. And then the 20 peak speed gigabits per second data rates, enabling HD medical imaging translation in real time. And then 1 million device capability connected within the square meter. When you come to medical healthcare, it's all about how the devices are getting connected and how speed you are transforming the information with a less latency actually. And then the reliability should be there. So your streaming of the data will be very critical, and then it has to be reliable. So that's where 5G comes into play, right? So when we in order to make it happen, the architecture has to be very strong for this one. So architecture has becomes powerful when applied to a real patient care. So what is that matters for us? What is that in the 5G enabled healthcare system architecture talks about? It is all about a device layer, network layer, and application layer. So we all know if you search visual it, device layer is nothing but your wearables, like our sensors we are wearing on your wrist or in your body, measuring the signals which is coming either the heart attack or stroke, or it can be any symptoms. It detects by the device layer. Network layer helps to transform the information. The network layer has many things, right? What is coming up now is the slices, right? Slices is something like if there are multiple bandwidths, one slices can be used for higher speed, one other can be used for medium for lower speed. So depends upon the emergency care or the what is needed for a hospital system. Network layer can be divided into multiple slices. So that's what the network layer helps over here. Say if I am wearing a wearables and measuring that information has to go through, it has to go in the highest bandwidth to the system where it travels, and then hospital side also it has to be processed and quickly adapted to the doctor, and then doctor will look into that and provide information how to recover the system in fault. Then basically the application layer where the data gets fed into the application layer where the doctor sees the information. There are AI right now coming into picture based upon the information which is received from the device to network layer to the application layer. It can act upon on the metrics, and then it says that, hey, for example, if there is a stroke within this time, and these are all the patient data is already available because of this reason, first attack, second attack, third attack, it can it can it can provide an information and then suggest auto as an immediate response, or immediate doctors are available so that they basically provide the information what is to be recovered for immediate emergency care even without you are visiting to the hospital. So this is the 5G enabled healthcare system architecture consists of device layer, network layer, and application layer, right? So using this, basically we are coming to the point where how to build the remote patient monitoring, right? It is a continuous care beyond hospital walls. We don't need a we don't need to visit the hospitals for immediate critical things. This will be measured through your devices, through your network, through your intelligence. So we transmit the data. Then basically what we do is, for example, in the case of uh, uh, continuous ECG monitoring, right? And then he can also talks about oxygen saturation tracking, blood pressure variability analysis, medication adherence monitoring. All those things will be part of real remote RBM can does that. For example, AI detects a subtle deterioration pattern hours before clinical symptoms appear. For chronic care patients, like a fewer hospital visits, lower readmissions, higher survival probability, personalized treatment adjustments. Hospital move from treatment events to preventing events. So instead of they go and act on it, it becomes a proactive measures. These proactive medicines will be helpful at a scale, right? So what is that we are going beyond now? The care shifts from reactive to proactive. Beyond monitoring, 5G transform direct patients into interactions. So that's how telemedicine comes into picture. So this is breaking a geography barriers to care. We said that we are going beyond the hospital walls, right? So what it does is um, there will be no lag. There will be a HD video quality, real-time data from mobile devices, AR guided self exam, specialized join remotely during procedures. Telehealth becomes immersive, not just conversational. So all those things will come into picture. So earlier it was how it was. It was a very compressed video, lag, limited diagnostics, right? These are all will overcome by using a telemedicine possibility. With the 5G enable, we do a real-time imaging from our remote diagnostic tools, multi-angle high-definition streaming, AR-assisted examinations, specialist collaboration in real time. It upgrades telemedicine from convenience to the clinical equivalence. Doctor can see more, hear more, and respond faster. So this is really important for us. All of this depends on one major layer, which is nothing but a wearable intelligence, which we talked about, device layer. So this is a continuous data fabric, right? So continuous data fabric is not nothing but about into medical use example like a cardiac alerts in seconds. What it does the variables, continuous glucose closed loop insulin, COPD spirometry tracking, BP patches for long term data. Think about something like if you get a cardiac arrest. Today, for sugar, we have a patch, applying a patch, and then it gives that there is a variation happens, then it ingests and then insulin, balance it out. Think about in the stroke case, right? We don't have a opportunity to do that one. If you are sensing a stroke based upon your historical data, so what it does is like, people are to take aspirin, right? So aspirin takes time to absorb on the blood, and then basically it makes the uh, 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 reduce the pain, and then recovery will be faster. So that's how the traditional ones are there. So now if you make it implement automation in your own body with this technology, wearable devices, that can be really helpful. For example, in the case of continuous cell data fabric, I just gave one of the example. Heart rate sensor is one time, glucose droplet sensor it can be another, respiratory monitoring. During the COVID time, we went through a lot of respiratory problem. So if you have this kind of um, devices to see how that everybody would have to use the device with the measuring that 99 and 98%. So we can always see the devices, we know which up or low, and then we take an action. What will happen if the same device measuring at a lower than 98, and then you want to act on it? So it will go and feed what is required to be done to recover your respiratory problem. Like same, like this is really helpful. And basically what happened is wearable shift healthcare to continuous data fabric. It is not no more like a watch to be census, because it's all about how you are integrating your technology into your health systems to for human to recover itself. That's how we have to see how the wearable health sensors will be coming out in the near futures, right? So we are talking about device layer now. So we are going to the network layer in the next, which is nowhere in latency more critical than emergency care, right? So the speed of the data is very helpful. So all we are doing, most of the speed we are using it for only for gaming. So you have to be a gamer, then it has to be just for fun part. But when it comes to healthcare, speed is more important than anything else. So how fast you are acting based upon your devices to transform through network layer is where importance comes into play. So that's where 5G with a higher bandwidth, improved coverage, ultra low latency, mass connectivity will come into picture. So what is each of the area, right? Ultra low latency response becomes enables remote cardiac monitoring, telesurgery, and emergency alerts. Right, same like a massive device connectivity. If one device wants to talk to other device, this is in the age of device talking to device instead of device talking to human, right? So it has to be interconnected, act upon, and then provide an input based on what the one device is giving to another device, and then that device responds back, and then in turn it gives a response back to show like what to apply on that as a final response from the message what you receive from the mirror, the devices here. So and then improved coverage and mobility. So you can see that the network bandwidth comes down and goes when sometimes it gets irritated for us, right? In this case, there is no chance that network slicing means 100% 24/7, all the 365 days throughout the year. Like it is very important, like how our birth happened, like from that point to the death, the machines are operating. So it is similar way. Network should also be available so that you are not going to lose your information to pass to the through telemedicine to act upon on the application layer where the information will be passed and then response back. That's where high bandwidth slicing comes into picture actually. Obviously, you'll be paying more for that, but at the same service, you'll be doing a slicing. Whenever you are using that service, you'll be paying for it. That's how 5G is going to get transferred. It's not like you bought a service and then you'll be end up paying it. So how much of service being used? That's why the quality of service is very important based upon your uptime. Uptime should be 99.999% uptime for a critical application for network slicing, which is very, very important. Based on the usage, maybe the usage for healthcare will be higher. Instead of charging this much, we will be charging $10 more, something like that, which will be critical for us. And then data-driven personalized care. So now AI into picture. Once the data is there, AI-powered pattern detection saying this is a sure shot um, health issue of what is going to happen. So you are going to prevent the attack not to happen. You give the input and then basically prevent the attack actually, right? That's how we can see how data-driven personalized care can be helpful using all this combination in the 5G actually, enabling a 5G network. So what are the critical challenges? So all those things we talked about just now, how 5G is going to help us out now, but there are some challenges over there. How security and privacy will be there, how technical reliability, how the infrastructure and cost is going to be, how ethical and legal will be, adoption and visibility. So whenever something comes into play, always security and privacy are very important. So you have to talk about interoperability, like we talked about how devices are getting talking each other, how the systems are fragmented, how it is going to get connected. So these are all very important topics to talk about how your critical challenges and consideration to be evolved. So whenever you do this kind of massive implementation, regulation will come into picture. That's where security, reliability, infrastructure, and interoperability. It is not just not like you buy a device and some hospital is label it. It has to be audited. It has to be secured, well tested, and then saying authorized. The custom, this hospital is ready to provide the service. Then basically this device from this company authorized, secured, data is transmitted in the secure layer, is not being tapped by somebody else, it's not attacked by somebody else. So all those things have to be challenged as part of considering this the upcoming 5G transmission, right? So going to future direction. So we talked about the current healthcare. So we are moving towards 6.0. When I say 6.0, right now 5G is already there. Using that, we can achieve a lot. When it comes to 6G, so 6G is going to get implemented in 2030. So it is more than the sub-millisecond latency. Then it's all about more into AI-enabled predicament. Then 5G compared to 6G, it has to be bandwidth slicing higher more. So whatever 5G is giving more will be enhanced further for 6.0. So you'll have a AI edge device which is acting on your currently responding. AI will be part of the device and then it acts and then gives the response back to do that one. And then we are talking about not the Wi-Fi or the fiber cable. We are talking about the satellite, right? Satellite is coming out or everywhere, like even in the remote location, satellite connectivity will be helpful. So you all know about the Starlink, which is being used to many places now. It's slowly evolving now. So in the future, like instead of many towers across, star satellites will come into picture where the connectivity will be faster, and the loss will be available anywhere and everywhere. And then of course, security framework will be very tight. Zero trust, privacy, privacy protection. Then of course, blockchain-based data integrity will come into picture. Quantum resistant encryption. All those things will come into picture. So it is a combination of IoT, healthcare, 5G in a early growth phase. Key development will enhance remote monitoring and connected healthcare in the coming decade. So moving on to the next one, path forward. What is the path forward? So we just covered most of the stuff, right? Path forward is healthcare and IoT, 5G or 6G, clinical outcomes, access and equity, and operational efficiency, patients empowerment. So all those things are very much needed. All 5G plus IoT fundamentally shift healthcare, right? Ultra low latency and high availability, edge computing and network slicing, telemedicine evolves to immersive lag-free care, wearable create continuous patient data fabrics, connected ambulance extend the hospital to the field, and then 5G enable precision telesurgery. So all this information will be helpful, and then how best we can going to study this, how best is going to be helpful for future medicine is what is important actually. That's a move forward plan with the connected healthcare for all of them, right? So this is the metrics we just presented here. It's all about 140 billion in 2023. It is getting projected to 800 billion by 2032 by in the IoT healthcare market. US market itself having a 350 billion worth of value in the US market with the wearables of 20 by 2035, which is annual growth rate of 14.5%, right? And overall is going to be a cumulative annual growth rate is 28% in the IoT medical devices. This much important is going to come. Electronics is going to revolutionize on the healthcare so that it will be useful for the common man to simply wear the device and recover himself. So you see how hospital admission, readmission is going to decrease, then medication adherence will increase to 40%. Of course, it will have a significant impact on the insurance, right? If your device, if you have a device and then the enrolled in the urgent care with the hospitals, connected hospitals, your insurance will go down a lot. So you are saving a money there actually. So insurance plan will differ completely vary. So based on that, there are a lot of savings will come for the individual as well as a lot of revenue in the market in the healthcare industry. So that's the key benefits of it. So to think about it, so you can do more about projects on as you all study and going through this, you guys will understand more about how IoT is important in the healthcare industry. So I've just given some of the winning ideas, hackathons topic. You guys can really use this topic for a presentation point of view. And some of the key ideas, like, I just picked up a top key ideas like ICU at home. We just talked about beyond walls, right? Connected ambulance, chronic care, digital twins, and then Cepheid early warning. Nothing but if you are having infection, actually, based upon the symptoms, you can always find out that infection symptoms and then alert it back, feed the input, process it, act on it. That's how it is going to work on. Then, of course, quality of service aware network slicing for healthcare. So these are all the key topics where you guys can think about developing your ideas into IoT healthcare can be beneficial for both healthcare and network industry. So it's all about combining telecom, data, electronics, as well as the healthcare, combining how to save the human life. Say today, we are saving a human life out of 10 to 50%. 50% we are losing, for example. So it will increase to at least 90%. So we are saving a life of additional 4 people. So think about that. So think through this hackathon's winning topic, and then it can be helpful over there. That's all for now to cover up. Good luck to you guys. And if you want more information, I have my information given over here in the LinkedIn. And then I have if you want to visit my Scholar articles, especially on the healthcare or in the telecom, go and visit my Google Scholar. I have an Archit ID. You can go and visit and provide your feedback on LinkedIn. Thank you so much. And Take care. Okay.